Hi everyone, today we're talking about the glossopharyngeal nerve, which is the ninth cranial nerve. Now, when you talk about this nerve, it has both motor and sensory roots to it, so it's both motor and sensory nerve. Now, talking about its course, first of all, this glossopharyngeal nerve, it leaves the anterolateral surface of the upper part of medulla oblongata. So, in the upper part of the medulla oblongata, you're going to see this takes a rise and it leaves through the groove between the if you recall the previous chapters, so this was pyramids. In medulla oblongata, this was olives, and this was inferior cerebellar peduncle. So between the inferior cerebellar peduncle and the olives, a nerve emerged, its rootlets emerged. So this is your ninth cranial nerve. Not only ninth, but even 9, 10, and 11. There were three of them. So 9, 10, 11, and hypoglossal was between the pyramids, remember? So yes, right now we're focused on the ninth cranial nerve, which is the glossopharyngeal nerve. So it arises from the upper part of medulla oblongata and it leaves as a series of rootlets in a groove between the olive and the inferior cerebellar peduncle. Then it passes laterally in the posterior cranial fossa and it leaves the cranial cavity where the jugular foramen. So this is important that you should know. How does it leave the first of all from medulla oblongata it goes to posterior cranial fossa and then it leaves the cranial cavity by going through the jugular foramen. And in the jugular foramen it is accompanied by the internal carotid artery and internal jugular vein. So these are the vessels that accompany it in the jugular foramen. So when it leaves through the jugular foramen, it's going to descend downwards, accompanied by these two in the upper portion of the neck, and then one part of it is going to go and supply to stylopharyngeus, and the other part is going to go between the superior and middle constrictor muscles, superior and middle constrictor muscles of the pharynx. It's going to go between them and it's going to go and supply the mucous membrane of the mucous membrane of the pharynx and the posterior one third of the tongue, posterior one third of the tongue. So these are its innervations. Now, if you look at this one, this is its motor innervation, and these two are its sensory innervations. So let me just quickly recap this entire thing. So first of all, it emerges from the upper part of medulla oblongata in a groove. It leads as a series of rootlets in a groove between your inferior cerebellar peduncle and the olives. Then it comes to the posterior cranial fossa and it leaves the cranial cavity via the jugular foramen. It is accompanied by internal carotid artery and internal jugular vein as it descends down towards the superior part of neck. And then one of its motor branch goes and supplies the elopharyngeus muscle, and the sensory branch, it goes between the superior and middle constrictor muscles of the pharynx to go and supply the mucous membrane of pharynx as well as the posterior one third of the tongue. It basically gives sensory innervation to posterior one third of the tongue. That's the reason you can feel the taste. And then, yeah, so that's about it. This is its course. Now, if you read it from the book, they're saying the same lines. The glossopharyngeal nerve leaves the anterolateral surface of the upper part of medulla oblongata as a series of rootlets in a groove between olive and the inferior cerebellar peduncle. It passes laterally in the posterior cranial fossa and leaves the skull through the jugular foramen. The superior and inferior glossopharyngeal sensory ganglia are situated on the nerve here. Right, so as it leaves the jugular foramen, glossopharyngeal has two ganglia, right? One is superior and the other is inferior sensory ganglia. So these are situated on the nerve here itself. As it descends, and then what happens as the nerve then descends through the upper part of the neck in company with internal jugular vein and internal carotid artery to reach the posterior border of the stylopharyngeus muscle, which it supplies. The nerve then passes towards between the superior and middle constrictor muscles of the pharynx to give sensory branches to the mucous membrane of the pharynx and the posterior one third of the tongue. So this was its course. So we are done with the course. Now, talking about its anatomy, so anatomical features. So, first of all, we have to look at the nuclei. This nerve has three major nuclei. One is the main motor nucleus. The other is parasympathetic nucleus, which is also known as parasympathetic nucleus, also known as inferior salivatory nucleus, right? Yes. And then you have the third sensory nucleus, which is in the nucleus of nucleus tractus solitarius. So this is some information that first of all you need to learn by heart, and then only will be able to move forward. That main motor, it has a main motor nucleus, parasympathetic nucleus, and sensory nucleus. Now when you talk about the motor nucleus, it's important for you to know that main motor. When you talk about this, it is important for you to know that its afferent fibers for the main motor, they come or it receives the afferent fibers from the cortico as corticonuclear fibers. It receives afferent fibers as corticonuclear fibers from both the cerebellar cerebral hemispheres. From both the cerebral hemispheres. So these are cerebral hemispheres, right? And then these are its afferent fibers. If you talk about the efferent fibers, so it gives the efferent fibers to the stylopharyngeus muscle. So this is very basic. That main motor, its afferent fibers come as corticonuclear fibers from the cerebral hemispheres, and efferent fibers they go to the stylopharyngeus muscle. So this is the motor fiber, right? Like these are the motor fibers which are going to supply this muscle, and we're talking about the main motor nucleus right now. Moving on to the parasympathetic nucleus, which is also known as the inferior salivatory nucleus, right? So inferior salivatory nucleus, first of all, we're going to look at its afferents, and then we'll look at its efferents. And when you look at its efferents, it will be divided into preganglionic and postganglionic. Preganglionic and postganglionic. So yes, so first of all, this receives its afferents from hypothalamus, where the hypothalamus, where the descending autonomic pathway, and the other afferent it receives is from the olfactory system, where the reticular formation, and the other afferent it receives is from the taste region, where the solitary tract, right? This might seem like too much information, but you need to know it. And then the efferents, when you talk about efferents, as I've told you, it has preganglionic and postganglionic. So preganglionic, its preganglionic goes to the otic ganglion, and that goes in three manners. What are the three ways in which preganglionic efferents go to the otic ganglion? One is where the tympanic branch of the glossopharyngeal nerve, and the other is where the tympanic plexus, and then you have where the lesser petrosal nerve. Then when you talk about its postganglionic, it goes to the parotid salivary gland. So these are the afferents and efferents that parotid salivary gland. These are the afferents and efferents that you need to know in order to have a clear picture of the anatomy of the nuclei of the glossopharyngeal nerve. Okay, now moving on towards the third one. So this is the one that you need to pay focus at, because it has some sort of course as well in here. Now, sensory nuclei, I've already mentioned they are present in the nucleus tractus solitarius. Now, what happens is that, first of all, let's get this sorted that our glossopharyngeal nerve, it has a superior ganglion and an inferior ganglion. I've already mentioned that previously as well, right? Now, what happens is that all the sensations which are primarily concerned with the taste are going to go to the inferior ganglion, whereas all the other sensations other than the taste, now you might be thinking, what are the other sensations other than taste that are going through glossopharyngeal? So it also includes the blood pressure regulation, and that is a very strange information, that why are the impulses of blood pressure going to the glossopharyngeal nerve? But yes, it works along with the vagus nerve in order to regulate your arterial blood pressure. So you don't need to be surprised. So even blood pressure is regulated by glossopharyngeal to some extent, not completely, right? But yeah, definitely the taste and all that's done by glossopharyngeal primarily. So inferior ganglion for taste, but all the other sensations other than taste, they're going to go to the superior ganglion, right? So this thing we've sorted. Now moving on, when you're reading the book Snell's, which is the reference book, you might not get clear picture of this because they've not clearly mentioned this. But yeah, this is true. Now moving on. Um, First of all, the taste sensation, and even okay, even these ganglions that we're talking about, they have a central process and a peripheral process. They have a central process and a peripheral process. The peripheral process is the one that is going to bring the information from the receptor organ, and the central process is the one that is going to take the information to the higher brain centers, right? Higher brain centers. So this is something that you need to know. When you talk about sensory, uh, afferent impulses from the receptor organ, such as posterior one third of the tongue. So information is going to come from there, and this information is going to come via the peripheral process. And then after coming from there, it's going to go to the inferior ganglion. From inferior ganglion, the central process is going to take the information to, I told you, higher centers of the brain. So let's jot down nucleus here. So nucleus of nucleus tractus solitarius, right? Or you can also say nucleus of the sensory nucleus of the glossopharyngeal. So one and the same thing. So tractus solitarius. So this is where it's going to go. Once it comes here, right? Now, for example, this is your medulla oblongata. Looks more like a butterfly. Anyways, so if this is your glossopharyngeal nerve, if this is your inferior ganglion, then it goes further to the nucleus of the tractus solitarius. From here, your nerve is going to cross over to medially towards the opposite side, right? And from here, it's going to ascend on the top towards the thalamus and hypothalamic nuclei. And then it's going to go towards the internal capsule where the corona radiata, and it's going to go into the postcentral gyrus, the lower part of the postcentral gyrus. So this is the roadmap. So posterior one third where peripheral process, posterior one third of tongue, and then where the peripheral process is going to go to the inferior ganglion, and where the central process is going to go to the nucleus of tractus solitarius. Then from the nucleus of central, uh, uh, nucleus of tractus solitarius, from here, the efferent fibers are going to do what? They're going to cross the median plane. They're going to cross the median plane, and then they're going to ascend to the thalamus, and um, they're going to ascend to the ventral posterolateral, ventral posteromedial, sorry, posteromedial nuclei of thalamus and hypothalamus. But bear in mind that this thalamus and hypothalamus will be of opposite side, right? Not the same, so it's contralateral. And then from here, it's going to go towards the internal capsule, then corona radiata, then the lower part of the postcentral gyrus. Yes, so that's how it's going to reach. Now, this is concerning the taste. So I told you all the informations which are not regarding or not concerning the sensation of taste, they're going to go to the inferior ganglion. So they'll go to the they'll go to the superior ganglion, all the ones which are not concerning your taste, right? So let's not ruin this diagram because it's perfectly fine. So all the other sensations, they're going to go to superior ganglion, and from superior ganglion, they're going to go to the nucleus of, which is the spinal nucleus, right? Spinal nucleus of the fifth cranial nerve. So these are other sensations, and the sensations which are primarily concerned with the blood pressure. They are going to go to the superior ganglion, but they are going to go to the nucleus of tractus solitarius only. But with that, they're also going to go. This is connected to the dorsal vagal nucleus. So yes, they both work in association in order to control the arterial blood pressure or any sort of blood pressure. So they basically regulate it. So they both work in association. But the primary difference is that they're going to go to the superior, and the other difference is that they're going to go to the uh, a different nucleus. This is going to be the nucleus of fifth cranial nerve, and this is going to go to the tractus solitarius, but also the vagal, dorsal vagal nucleus. So that's about it. And now, if you talk about its clinicals, so glossopharyngeal nerve, it supplies, we know that it supplies the stylopharyngeus muscle. We also know it supplies the posterior one third of the tongue and the mucous membrane of pharynx. But it's any, clinical anatomy which, or any lesion that solely involves glossopharyngeal nerve, that's rare. So usually, if glossopharyngeal is getting affected, so there are other nerves as well. For example, vagus nerve, which will be affected, and you'll see a lot of implications that yeah, vagus is affected because you'll see its signs and symptoms. But it's rare for glossopharyngeal solely to get disrupted or injured or whatsoever. So in the very cases, if there is, and because I've already mentioned, isolated lesions are rare for glossopharyngeal nerve. So in the cases, if there is a lesion in glossopharyngeal nerve, it's going to affect the posterior, the taste, right, at the posterior one third. So the taste sensation, and other is the gag reflex. So it's going to also affect the gag reflex. So the patient can be tested, and yeah, for testing, I've seen in the physio manual that they said that let's read that out. That they're saying that you have to have torch, tongue depressor, and an orange stick. This is a test for the ninth nerve, where you are going to check the taste sensation in the posterior one third of the tongue. Loss of taste occurs when there is lesion of glossopharyngeal nerve. Gag reflex, tickle the back of the pharynx and note if the reflex contraction, the pharyngeal reflex of soft palate and pharynx occurred or not. So yes, that's pretty much it.